Hello everyone, and welcome to this audio podcast. This audio podcast as part of the Percolation. This audio podcast is part of the Bostics Torpedo and the Specials. This audio podcast is part of the Spectre and Newsflash. This audio podcast is part of the Cases and Evidence Based. And this audio podcast is part of a Storm Robotics production. Through this audio podcast, I look at in and around some of the more intensive laboratory investigations in around the in around the in around the sort of around the sort of workup or investigations in around the diagnoses of osteomyelitis and in around in around S aureus or staph aureus. So excuse me. Other laboratory methodologies or investigations of identification for the identification in round osteomyelitis can also include observation of mannitol fermentation, where mannitol fermenting S. aureus, Staph aureus can be discriminated from non-fermenting S. epidermis. DNA's testing testing can also be used or utilized to distinguish DNA's producing excuse me to distinguish DNA's producing S. aureus from non-producing S. epidermis. However, both methodologies also require sort of a basis in around inoculation on selective and differential mannitol, salt, and DNA's agar respectively. The methodologies can be used in conjunction with the coagulase with sort of the sort of preliminary coagulation testing or screening and in around this investigation, sort of in around sort of the preliminary coagulase test, there is the investigation under microscopy of gram positive cocci, and then wherein then catalase test or screening can help in around determining in around catalase positive staphylococci or catalase negative streptococci, and where then catalase positive staphylococci, for example, then allows the use of sort of a more delving into the use of the coagulase test, and to determine to determine a Staph aureus or S. aureus, and also where it can help to determine coagulase negative and S and staph epidermidis. And then additionally DNA's test or DNA's positive, where DNA's test positive, if there's DNA's positive test or screening, that can then reveal Staph aureus, and then DNA's negative analyses can reveal staph epidermidis. Then in around sort of mannitol fermentation can reveal Staph aureus, and then non-mannitol fermentation can also reveal staph epidermidis. At the same time, though, in sort of In some established sort of academic works and papers, osteomyelitis, for example, is mostly common associated with S excuse me, with S aureus. Also, there is sort of investigations in around what's referred to Kirby-Bauer disc diffusion susceptibility screening, which may be performed to help physicians or clinicians in choosing an applicable antibiotic pharmacotherapy. This is to sort of determine the sensitivity and or resistance of a patient's S aureus strain to antibiotics. In amongst literature, now obviously where M. Hussain had originally excuse me had originally sort of the sort of the underpinning writings and around this it is where in amongst the literature at the time it is where it had been informed in amongst the literature that to do this to determine the sensitivity and or resistance of patients or recipients S. aureus strain to antibiotics, point 0.5 McFarland standard of the patient's or recipient sample is utilized to culture a lawn, a sort of culture a lawn on Mueller on particular agar plate referred to as the Mueller-Hinton agar, which is and then specific antibiotic impregnated discs can then be evenly distributed on the top on the top part of the agar plate, and then resistance or sensitivity can thus be determined by observation of growth or lack of growth around each disc accordingly. So as described by authors by author, for example, by author Brokema in sort of retrospectively, Brokema and team retrospectively, oxacillin and cefotoxin, cefoxetine are both beta-lactam antibiotic disc commonly are sort of the are both where both forms of treatment sort of prompt the use of beta-lactam antibiotic discs, which are commonly utilized when dealing with S. aureus. Resistance to oxacillin, and cefoxetine are indicative of methicillin resistant S. aureus or MRSA, a highly antimicrobial resistant or AMR strain of S. aureus. In addition to the Kirby Bauer method or methodology, epsilometer gradients or testing and broth microdilutions can be utilized to determine the minimum inhibitory concentration or MIC of antibiotics needed against drug sensitive S. aureus of S. aureus. Automated microbial susceptibility testing using VITEC2 organisms can be utilized to identify MRSA whilst establishing an MIC of antibiotics against a sample of organisms. VI-Tech2 also acts as an efficient system for aiding both specific bacterial identification and in around pharmacotherapeutics. That draws this audio podcast to a close. This audio podcast as part of the Percolation. This audio podcast as part of the Spectre and Newsflash. This audio podcast as part of the Bostic Torpedo and the Specials. This audio podcast as part of the cases and evidence based, and this audio podcast as part of a Storm Robotics production.